Caring for a loved one with dementia, autism, or a brain injury can be overwhelming. How do you help them stay independent while easing the burden on caregivers? Enter MapHabit, a groundbreaking platform using visual mapping to create step-by-step guides for daily tasks, empowering these individuals to navigate life with confidence. In today's episode of the Healthcare Wayfinders, I sit down with Matt Golden, co-founder and CEO of MapHabit, to explore how his innovative tool is transforming cognitive care. Matt's personal journey, combined with cutting-edge neuroscience, has led to a powerful solution that's helping families, caregivers, and healthcare providers alike. We'll dive into the science behind MapHabit, real-world success stories, and what's next for this game-changing technology. Let's get started. Matt, man, thank you so much for coming on the Healthcare Wayfinders podcast. Super excited to talk to you about the great work that y'all are doing at MapHabit. Why don't you give us just a brief overview of what MapHabit does, and then I want to go back and hear the story about how and why MapHabit came about. So give us a little intro, and then we'll head that direction.
Awesome. Great. Thanks so much for having me, Zach. I've been looking forward to this for a while. Again, my name is Matt Golden. I'm the co-founder, CEO of MapHabit. We help people with dementia, intellectual disabilities, and traumatic brain injuries live out their daily lives by providing visual cues that can help them complete tasks that we all take for granted. Our technology platform allows any caregiver to easily create and share content that builds or maintains independence, and share that content with the entire care team or anyone that's on the MapHabit platform. So to give you an example of what that actually means is, let's say my daughter is really struggling to brush her teeth on a consistent basis, and she either forgets to do it at the right time, she fights me tooth and nail to actually get through the tasks, and she'll forget certain steps along the way. So what MapHabit allows you to do is build a visual map on doing that task. So a visual map can be using your smartphone in our app, taking a picture of that toothbrush, taking a picture of the toothpaste, taking a picture of putting the toothpaste on the toothbrush, recording a short video of my daughter brushing her own teeth so she can't say that I can't do it. Look, this is you doing it. And then actually taking washing it off and washing her hands and basically getting through the whole task. So the whole idea is personalizing these activities of daily living and giving people a really great daily routine that they can walk through each of these tasks on their own without a parent or a home health worker or anyone coming in and nagging them or doing it for them, which doesn't help with your independence. So it's really all about empowering someone so they feel confident in a dignified way that they can actually get through their daily routines. And we've had a lot of success stories.
That is super amazing. And I can totally see how valuable that would be for somebody that's struggling with a diagnosis like this, and even their family members or caregivers who maybe didn't have a background in it before, but still want to take care of their family member and need some tools to do that. So that's just amazing what you guys are doing. Talk to me a little bit about the background of why you guys started this. It feels like it's probably coming out of some personal experience of yours, but I'll let you tell us.
Yeah, I was doing management consulting for a number of years, basically configuring financial planning and analysis systems for large Fortune 500 companies. I was making good money. It was challenging, but at the end of the day, when I was getting up in the morning, I just wasn't excited about it. And rewind about 20 years ago, my uncle got diagnosed with early onset Alzheimer's disease. And I got to see firsthand the whole journey that he and my aunts went through. It started with not being able to calculate the tip on the bill, to not remembering the steps in which to get dressed or bathe. And then the impact that had on my aunt, who's a family caregiver with no healthcare experience. She was thrown into this caregiving role, didn't identify as a caregiver, but knew that she really had to drop everything to support her husband, who really didn't know what was happening and was having a lot of trouble. So it it was a huge burden on her mental and physical health started deteriorating. And it was so hard to see that from a distance. I wasn't the primary
Wow.
caregiver. Yeah. And I knew there was a better way. I knew that if my uncle had tools, whether it was a printout of what to do at various, points of the day, or there weren't really as many smartphones back then, but there are now. If he had a list of the steps to complete tasks that he can visually see, he could probably have done a lot more on his own. So now fast forward 20 years later, me and my co-founder, Stuart Zolo's a neuroscientist, we met in our neighborhood. He was walking his dog one day. I always knew that he was in healthcare. I didn't really know exactly what he had done. Started talking with him, and I was fascinated. He had all these great ideas about different ways of mapping out routines. So there's something called mind mapping, where you take a central idea and have these like branches of kind of subtopics. And we basically built MapHabit around this concept of having a central theme and mapping it out into step by steps. So there's a whole lot of neuroscience behind why that works and why following pictures step by step activates a spared region of the brain that's not impacted by neurodiverse conditions, that actually stays intact in function and capability for very long into these conditions, that you can effectively build muscle memory and do the same steps over and over. And before you know it, you're not even thinking about it. You've learned this task after having a stroke, after having moderate to severe Alzheimer's disease, having a traumatic brain injury where you don't remember your name on a given day, or a child with a pretty severe developmental disability who really has had trouble learning these tasks and routines. If you can visually map them out and create that habit, then they end up being able to do it like much faster than what they would using the standard of care.
Wow, that is so cool. It's so cool that you met your co-founder in your neighborhood. That's a story right there.
Some things happened by chance, and I was looking for something different. He had already retired twice, and he's quite a bit older than I am. And he was like, I'm not done yet. I've got ideas. I want to continue to push through and really make an impact in the world. And I was also at that point in my life where I had a really good career. I could have kept going on it, but I really wanted the next chapter to have a little bit more meaning and a little bit more impact. I wanted to pay homage to my late uncle. I want to celebrate my cousin who's living with Down syndrome and has a lot of behavioral needs and needs basically some of these compensatory tools to stay on task. So there's a lot of motivation for doing something different and really trying to innovate in a world or a system where there really hasn't been a lot of new developments, especially in behavioral health. And there's just not enough workers. There's not enough people that can support the growing numbers of people with autism or Down syndrome or Alzheimer's disease, and activating and empowering and educating family caregivers so they can be critical thinkers and better support partners, and flipping the script where you don't have to do everything for that person. You can set them up with success by personalizing these routines and allowing them to go through it on their own. It was just like the perfect storm where we had to jump in on it.
Now, I know you guys have been doing this for a few years, and you've hit some pretty significant milestones in that. Can you tell us a little bit about where y'all have come from and where you're at today?
Yeah, so we early on started down by getting clinical research data. So my Stuart, who's a career research scientist with the VA, with Emory, with a lot of different institutions, he had a lot of success getting National Institutes on Aging grants over the years. And really within the first 6 months of us starting the company, we decided that was the path for us. Not only is this a great way to prove your intervention works, you're putting a lot of rigor and science behind it. You're basically standing out from a pretty crowded field sometimes with new technology, that ours is evidence-based, and we have proven it through peer-reviewed publications, independent statisticians. We've worked with all sorts of different individuals, from, like I mentioned, kids with Down syndrome through veterans with traumatic brain injuries to older adults with dementia, and really their caregivers, who is our primary focus. We basically had a lot of success getting these grants. We never got the first one on the first try. We always had to resubmit it because we forgot something that we needed to put in there. But it was through that process of doing clinical research and basically having a hypothesis, testing that hypothesis, learning about things that we thought would work that didn't work, iterating then on the design and based on the user feedback, that we then got to a point where the platform really started to work in a lot of unique ways. And we've been able to get reimbursement for it, both at the state and federal levels. And now we're working with pretty large health systems and health insurance companies to have this covered for the tens of millions of people that will benefit from it.
Yeah, that was where one of my next questions was, if I have a parent who's been diagnosed with like early onset Alzheimer's, how would I connect with you guys and use your product? Is that something like my doctor needs to prescribe for my parent, or how's that work? How do people find you?
Yeah, it's a great question. And I'll give you two answers, one for the older adults with dementia and their caregivers, and then one for some of the more neurodiverse populations that are covered by Medicaid, since those are our two primary kind of groups of populations. For the older adults with dementia, we have a partnership with a health system here in Georgia called WellStar. For a limited time, we have folks that are associated with the WellStar system can basically get MapHabit for free. It includes a coaching, one-on-one coaching. We'll do a kind of a needs assessment on what are some of the opportunities for building habits and routines, not only for the individual with dementia to ease their daily routines, but really supporting the family caregiver who needs dementia education and whatnot. So it could be through WellStar, one of our commercial partners. We also are doing still a lot of clinical research where you can be paid to be in one of our research studies and get that same 6 one-on-one sessions with a dementia expert. You get a tablet, you get some compensation, and really you get all this great education and tools to improve your quality of life and the independence of the one that you're supporting through some of our commercial partners. But really, I think the clinical research angle would be a great way to start utilizing MapHabit. The other route is through what are called Medicaid waivers. A lot of times those with a developmental disability or traumatic brain injury are covered under home and community-based services waivers. And we're covered in about 15 different states right now, where you can basically contact your support coordinator or case manager, where you have a individual service plan, and get MapHabit added, so there's no cost to you. So that's another option, is through some of these Medicaid waivers. Yeah, there's plenty of different ways. We will have a direct-to-consumer offering sometime in 2025. We're still working through all the logistics there, but for now, there are many of other options to be able to utilize MapHabit.
Okay, thank you for that. I'll be sure to put links in the show notes so that people can find those different options that you were talking about. I've been seeing a lot of people talking in the news, especially about athletes with like CTE, and who are suffering, more and more folks who are suffering with that, who play high contact sports. Is that a population that can benefit from using MapHabit?
Yes, for sure. Really, anyone needing additional cognitive support, it really doesn't matter if you have a formal diagnosis or not. If you just have trouble concentrating, if you have trouble getting through your day with a lot of stress and anxiety, if you rely on a family member to help you with some of these routines, MapHabit is very basic. You're sequencing pictures step by step. So all you have to do is follow pictures. You don't have to speak any spoken language. You don't even need to be able to read. You just imitate and basically follow the steps on a visual map. And then after a while, you actually develop this muscle memory by seeing the same pictures and doing the same activity over and over, and you do it without even thinking about it. So that would pertain to someone with CTE or someone with a traumatic brain injury, which we have done a lot of work with the veteran community. They struggle with really executive function, which is, how do I get through my day and do it in a way that is dignified, but then also remembering the right steps and routines? So yes, someone with CTE, someone who's just had a stroke, someone with an Alzheimer's diagnosis, others with developmental disabilities like autism or ADHD. There's a whole bunch of different types of actual diagnoses where it's covered as a reimbursable service. But really, anyone who really needs help getting through their daily routines would benefit from visually mapping them out.
So when it comes to the actual technology, you guys have some kind of a tablet or something like that, or an app where, a caregiver can map out some type of activity that they want their loved one or whoever it is they're taking care of to be able to follow. Is that kind of the process?
Yeah, good question. So when we get a new client to work with, we'll spend about 45 minutes getting to know them, really understanding what are their needs, what are their abilities, what kind of environment do they live in? Do they live in a house? Do they live in an apartment, senior living, or are they in a group home, for example? Who are the connections in their life? Are family members involved? Is it a home care, home health agent? Is it a direct support worker? And also what are the things that really make them tick? What are their interests and whatnot? All those kind of come together. It's called a psychosocial needs assessment. And then based on those answers, we have content that's already made. Maybe someone's having trouble brushing their teeth. Maybe they're looking for mindfulness activities to get back to center and tap into their mind, body, and spirit. Maybe they're looking for safe seated stretches that they can do to stimulate blood flow and avoid a fall. So all those things come out on that initial conversation, and then they'll have these content that they can use right away to help build those habits, routines, or they will work with our coaches and really on a biweekly basis for that first 2 months. We will help them visually map out, not the whole day. We'll focus on one or two. You don't need to solve world's hunger all at once. You just need a couple quick wins and then really see the power of tapping procedural memory to basically develop this non-conscious learning technique. And then your brain gets rewired into thinking, breaking things down into different steps. So that whole task analysis is something neurotypical people just do automatically, and it works for really anyone. Yes, you can access it through the app. We have printouts that take basically the same pictures that you would take with your camera and load in through the visual map. We can print those out, mail a booklet, can get them laminated if someone's forgetting to always basically use the soap in the shower or forgets their steps to brush their teeth or even to make coffee. There's a lot of modalities you can use, but effectively you meet with us for a bit. We'll help you better use the platform. And really after a couple of weeks, you're really off on your own and are able to use it through any iOS or Android device or on paper.
Very cool. Do you guys provide any support or resources for caregivers that are maybe experiencing conflict with the person that they're trying to help, whether it's I've just heard stories that sometimes it can be super difficult for the person that has this diagnosis who could get, frustrated really easily or something like that. And maybe the caregiver is used to this person acting a certain way, and now they're acting in a different way that can be hard to deal with sometimes. Do you guys have resources for folks who are experiencing that?
Yeah, and that's very often with the older adult with dementia community. That's why we do most of the time focus on the caregiver and help them understand some of the root causes of some of these behaviors to help them. Why is this person, my loved one, trying to leave the house every day at 1 o'clock? I can't get them to just stay at home and they keep fighting me the whole time. Well, when we talk with them, we realized they were a mailman. And every day at 1 o'clock, they would go out and that was their job. So you can basically say, hey, let's go out and let's deliver the mail. And you end up just walking around. It reduces that anxiety. But unless you ask those questions, unless you focus on the caregiver, on self-care and making sure that they are taking a break, they're getting the respite that they need, it is a lot of kind of coaching and counseling. And we have licensed clinical social workers and dementia care experts and even behavioral analysts and occupational therapists that work with some of the families in addition to our care navigators as well. Long answer to your question, but yes, it's just about as much about the caregiver or the support partner as it is the person that they're supporting.
We're getting a little bit towards the end of our time. To close it out, what do you guys, what's coming up in 2025? Where are you going? What want to do? How do you want to innovate on even the great things that you're already doing to help people who are dealing with these conditions?
Yeah, no, thanks for asking. We are really working a lot with some of our partners in we have this available in all 50 states with some of our health plan partners with various rollouts in a couple of key states like California, New York, Florida, Kansas, Georgia. Also, we are building out more of our content library on cognitive engagement and really working on new types of routines and basically things that work on fine motor, gross motor skill, bilateral coordination. We're having different things like different maps of the month that are sent out alongside various kind of mood regulation and fidget toys and whatnot to help out with basically staying centered and keeping that focus. We're going to have a direct-to-consumer offering later next year as well, which people who aren't necessarily associated with a health system or a health plan or who don't have a Medicaid waiver or are part of an area agency on aging that we partner with can still utilize MapHabit to their benefit. And also doing more clinical research. We're doing some work with the Shepherd Center here in Atlanta, which will continue through next year. As I mentioned, we have a really cool study with the National Institutes of Health that focuses on caregiver training. It's a 6-month program where they get a free tablet. They get those 6 coaching sessions. They get access to a whole bunch of content and the ability to visually map out some of their routines that we're really excited about in the new year.
Matt, thank you so much for coming on the show. Just so appreciate you guys and the great work that you're doing at MapHabit to really make a difference in people's lives. We're going to get links to all the good stuff that you're doing in the show notes so that people can keep up with what you're doing and access those services as they become available. Appreciate you and thanks so much and have a good holidays.
Thanks, Zach. You too.